segment. Dr.
Sure,
Jacqueline Besesa McKenzie, are you there? In a moment. Minister, can you help us with this matter of the Appropriations Committee? The Appropriations Report. Do you know, firstly, I want to have an idea as to what they're supposed to look like and what entities.
I'm not the right person to speak about that. The Chief Accounting Officer,
Yes,
the Permanent Secretary, deals with those matters.
I know it's his responsibility. What I'd love to find out is what do they actually look like and what do they represent? I know he mentioned Bellevue and the government chemist. These are areas for which they've submitted the accounts. So I'm trying to understand.
Right. It's really how resources are spent. It's an accountability kind of framework to look at expenditures, how they are determined, how they are spent, who is a responsible officer or officers, what has been signed off on, because it really aims to provide some levels of transparency and accountability, and of course ultimately value for money, because we deal with taxpayers.
Right.
As I understand it, this particular issue, and again, I don't want to go too much into it because it's not my area, but this dates back to a fairly long period, a period before this administration. So I think it goes back to about 10 or 12 years.
13, I hear, 2013.
Right, somewhere around there. And the real issue, as I understand it, is the earlier years where expenditures were spent, were laid out, and there was inadequate information around how those were spent, who signed off, and there's a requirement now to bring all of that up to date. Now, while the more current data is available,
yes,
the
previous years,
the pre-data, yes, is not. And what I understand the PS to say yesterday in the press brief is that when you go back, when you ask the current administrators of the process to sign off on some of that information, in some instances inadequate information, they are refusing to, because they don't want to be on the firing line for something that they had no sort of oversight over. And the people who were supposed to sign off, in some instances, they are dead.
Yes, I got that. So I'll take it up with the Permanent Secretary at the appropriate time.
That's a real issue, which I think we need a resolution. And then there were some issues related to the software at Ministry of Finance.
Right, the FinMan. I'll make him explain it some more. Dr. Jacqueline Besesa McKenzie, just before we take a call, the press release from the PNP says maternal mortality in the Southeast Regional Health Authority has skyrocketed from 27 per 100,000 to an unprecedented 273 per 100,000. This is a tenfold increase, they say. Do you know if this data is correct?
Over what time period? I really
that's the question I've asked myself. But you don't know these numbers.
I really would have to look at that. I'm trying to lay my hand on the figures as we speak, but I don't really have that number on me. That would the range of time that we're talking about is important, but I'd have to check it. Let me not comment if I don't have the figures in front of me.
Are we now at 273 per 100,000?
No, we're at 100, and I think it's 139, I believe, per 100,000 for 2023. We had about 40 maternal deaths in 2023.
Okay. We do have Dr. Dayton Campbell coming to talk with us after, so I'll try and find out where he's got these figures from that they've put in the press release for the PNP, because it doesn't say. So if anybody out there is listening and you have an issue concerning health, give us a call now so Minister can respond quickly. So to the Chief Medical Officer, 876-926-2178, 926-8631, 926-7615, 888-991-2080. So initially when you were talking to me as well, Chief Medical Officer, you said when you called the SMOs yesterday, you got that it's 100 ventilators that were in operation.
About 100.
Okay.
that we have that are working presently.
Right. You see, I know you say we're not to be too stuck on the numbers because of the daily checks that have to be done with the ventilators. But you called around and got 100 yesterday, but then the minister represented 118.
That was what the audit said, yes.
Yes. So
Yeah, what I realized when I looked at some of the numbers, and I tried to clarify that in the
yes.
press conference yesterday. I guess it depends on who you get the numbers from, within the institutions. But I recognize that some persons were counting anesthetic machines as ventilators. And so they would have ventilators in the operating theater. So I think that may have skewed the numbers a little bit.
So you don't have a better accounting than that? You don't have a point person wherever to literally in the dead of night to be able to give you that information?
We do have our point person, who is our chief anesthesiologist. And as I'm saying, when you speak to people, you recognize that in trying to put together the numbers, probably different information came in and was submitted, and after doing their checks, they would have recognized some of those.
But I think it's important to note, though, that those very machines are also used in providing ventilation services. Technically, they are used for that too in particular context. So it's easy to understand why, and I'm clearly not a clinician, but it's easy to understand why those would also be included. But Emily, I think the numbers, one has to be very careful about how we get caught up on these numbers, except to deal with adequacy, as to my mind, the most substantive point. The CMO said something that was quite instructive, and the country should recognize that pre-COVID, we had about 30 of these machines in the system.
And those were not adequate.
Post-COVID, we have over 100.
So how much do we actually need?
And she's also on record of saying that we have spare capacity. That's what.
But I heard that, and I'm so sorry. I don't really want to cut you, Dr. Tufton. I'm so sorry. Sure. But Dr. Jacqueline Bisesa-McKenzie, I don't even understand how you come to that conclusion when we are told that at least in one instance in Maypen, a baby had to be manually ventilated, and in the end, for whatever reason, she died. How can you say that you have adequate supply when there was an instance when someone was needed and there was none?
Right. So remember, no, we're talking about a difference between an ICU capacity, because it's not that we did not have ventilators, and we have to. Sometimes when people report, they say things because we would have had available ventilators at the Mandeville Regional Hospital, and we would have had ventilators available in other facilities. But in terms of the ICU space, which requires other things to be in place, then you need to have all of that. And we do have a critical shortage when it comes to our nurses to be able to activate an ICU space within a certain time. And this is what I'm saying about working together and the referral system, because if you call at 3 a.m. in the morning, you may not have a space because we may not have enough persons on the ground to activate the space. But then within a few hours, we're able to get that space up. So the dialogue is important, when it is that you call, how it is that we work together to optimize. And we've had the conversations about this with our clinicians, both before and since this incident, to ensure that this kind of dialogue to really be able to properly utilize what we have is available.
But can I say that this applies to ventilators as it applies to beds, as it applies to A&E. The University of the West Indies recently put out an advisory to discourage persons, unless absolutely necessary, from coming to their A&E because they were inundated with the demand on the system. From time to time, the Bustamante Hospital for Children during the flu season have to refer patients to UWI. Every hospital system in the world operates on a referral process because very few systems caters to extremes. They cater to normal circumstances, and they have to, I don't want to use the word juggle, but have to find ways to improvise when we have extremes. We clearly did not have capacity for COVID when COVID struck. We spent 3 months putting in high dependency units, converting the PROMAC units, bringing in ventilators, clearly because nobody was prepared for that. The same applies cyclically to an annual period where we know in certain months of the year the demand is going to peak, where we know that during Christmas hospitals are going to be full because people overindulge, road traffic accidents are going to increase because people consume alcohol more than usual and drive on the roads. And what you try to do during these periods, you cut time off, you make arrangements with other institutions. It is the very same principle, and that is how all health systems operate.
I have to take a question from Carl right after this break, and then we'll wrap both of you. Hold on.
Hello?
Carl? Carl, can you hear me?
I'm hearing you.
Yes, go ahead and ask a question of the Minister and the Chief Medical Officer.
What I'm saying is that down here in Falmouth, we are having a problem. Recently, two doctors had a fracas there. I want to know what is the result of any disciplinary action that was meted out to any of them. Secondly, recently there was another problem again where a lady died. As far as I am concerned, that's criminal negligence, as to what I've heard.
How you get so far?
No, because of what me hear or what me see.
Yeah.
No, me have a right to say that.
No, you can't just say that because the test, legally the test for that is extremely high.
Yes, but if the lady says her mother died because she provided medication, and it was not administered,
well,
there's another problem again. My neighbor got sick. She has a heart problem, and they are sending her to go, after so many days, they're sending her to do some tests outside. I thought there was a public and private partnership. She has to pay money.
What test
money
she has to do outside?
Have.
What test?
Heart test.
Heart test. All right.
For 24 hours.
Let the Minister answer that.
She find those money.
Thank you so much, Carl. Thank you, Minister. This thing where people are being sent outside to do tests, even though the public system is supposed to have. Tell me what's going on with that. Minister Tufton? Not hearing the Minister. Minister?
Minister, I'm not sure what has happened, but let me try to answer.
Yes, CMO.
Okay. So even with the public-private partnership, there are going to be some tests that are not offered within the public sector. And I would really need to get a little bit more detail on what specific tests you're talking about.
He says heart.
Because we have a variety of heart tests.
Okay.
But some, as you know, and the public sector will be able to provide many things, and we try to provide the majority of the needs of the majority of the patient. There are always going to be exceptions that we would not have attained that capacity as yet to provide that test. Falmouth Hospital is a type C hospital, so there are some services that wouldn't be offered there, and certain diagnostics that wouldn't be available there, and persons would be referred outside to do them. But where it is, I'm sure everybody is aware of what is available under the public-private partnerships. And when I say everybody, I mean within the hospital. So if it is that they have sent you to do a test where it is that you have to pay, it is probably not covered under the public-private partnership.
All right.
And you would have to recognize that there's going to be some things that may not be covered.
We have to leave it there. Thank you so much, CMO. Thank you so much, Dr. Tufton, Minister of Health. Look forward to having you both again next week, God willing. Take care. That's extended question and answer because of some of the issues arising coming out of the news. I'm going to join Dr. Dayton Campbell because the PNP sent out a press release and they say for more information where to contact him. And the headline of that press release, I told you, PNP issues urgent call for action on maternal and neonatal health care crisis in Jamaica. Do we yet have Dr. Campbell? No. Dr. Dayton Campbell, we're trying to reach you. Let me take a call in the meantime. 8631. Hello? Hello?
Hello?
Hi, welcome.
Miss Emily?
Who is this, pharmacy man?
No, I was on the line.
Oh, it's Carl.
Yeah.
You come back?
No, I did not come back. I didn't. They didn't bump me off.
Oh, okay.
See,
Sorry.
I find it strange, because the public is not. They are not being informed about what is taking place in the health sector. Because I cannot see for the life of me how somebody poor is going to be hooked up to a machine for 24 hours. It must cost money. They don't have that. So why she couldn't be sent to Kingston or Cornwall Regional? That is what I want to know.
No, but what was the condition there?
She had some heart problem.
Yeah, but is it that condition couldn't be treated at the...
Could not be treated because her pulse went down to as far as 20.
And what happened to her eventually?
She has been discharged. I just went over there to look for her.
So why do you think if she's well enough to be discharged, why do you think?
No, the diagnosis was not complete because the doctors needed that test to find out.
Oh, the one that they sent to private.
Right. You see, but she could have been sent to Kingston. Why discharge her?
In their medical wisdom, that's what they think.
That is what I'm saying.
Yeah.
So the two doctors fighting over at the hospital about public facilities to put money in their pocket.
What do you mean fighting over?
Yes, it was on the news. You people carried it so I can talk about it.
No, that doesn't.
I don't call no name.
I didn't see the story. I didn't see.
Yes, ma'am. Oh, you don't get that, Miss Emily.
Yeah, I miss a lot.
One was even transferred
to
Montego Bay. I am not calling any names, but I'm telling you it happened right at Falmouth Hospital.
Okay.
So why are they keeping it so secret?
No, but you said you heard it on the news here,
yes,
so it's not a secret.
I'm not lying, ma'am.
No, I don't say you are, but I don't think it's a secret because you saw it on the news. I just didn't see it.
But I just want to know what was the result of any disciplinary charges that was preferred.
All right. When I find out, I'll tell you.
No, me not going on.
When I find out, I'll tell you. You keep listening to. Yeah? All right. Thank you for the call. 926-7615. Hello?
Hello?
Hi.
Hi, good afternoon.
Afternoon. Who is this? These lines are not working so well today at all. I suppose Dr. Dayton Campbell will probably come to you after. He's on? Oh, but the line cut off. Okay, that was Dr. Campbell. It did so. Let's come to think of it now. In retrospect, he will join me for a couple minutes and then we'll see how that goes. Dr. Dayton Campbell is the General Secretary of the People's National Party. Trying to ring him back now in light of his press release. Dr. Campbell, are you there? No, not yet. All right. 9268631. Hello? Hello? Welcome.
Good morning.
Hi, morning. Welcome.
Just having in terms of
I'm not hearing you well. Sorry. Say that again.
The Sablamar Hospital.
Yes.
I think Dr. Tuffman needs to take a look there at the accident and emergency.
Yes.
In terms of how many persons can be facilitated in the space that they have. Because it's really cramped. And the doctors there, I know we're personnel lacking in the hospitals, but Sablamar is in a crisis. And I think we need to look at people as human beings. We're overwhelmed and we have a lot of persons and less personnel and more people coming in. And I know we have accidents and we have lifestyle diseases, but we're where we are right now. And we just need to look at it a little bit better in terms of service.
So we'd have to build more space.
Build more space, but in the interim, what we can do is use, as I said before, use field hospitals or field hospital for the accident and emergency until we have those buildings. So it has a lot of space. Most of our hospitals have a lot of land space. So we can look at putting some field hospitals here, hiring more personnel and using those spaces until we finish building what we are building. But as it is right now, Miss Emily, It can't remain. People are dying.
When you go there to A&E, seems you have gone there. Tell me what sorts of patients you see coming in. Accidents?
Accidents. I've been there because of an accident. It was a motor vehicle accident. You have a person who is coming with maybe high blood pressure, stroke, and all of those things.
Yes. Okay.
Respiratory problems.
Yes.
And all of that.
So we need something more than what we have.
Because we're having those issues, and they're real issues. It is what it is.
Yes.
It is what it is right now. We're talking about now. Lifestyle changes need to be done, but we have this in front of us right now.
Yeah. You see, the thing is that there has been a near 200%, could be more, increase in the budget for health. But you are right in that where we are, we need much more.
Yes.
The question is, what is it that we are going to cut to allow health to get more? Because health has had much more for capital expenditure than a lot of other ministries in the last couple of years. But we still need more. Something has to be cut.
Emily, you know, when you realize how bad it is when you go there with a relative of yours. That's when you hear all that kind of stuff. But see, when you go and see, and like, oh my God, my family member might die right here, right now.
Yeah, understand.
That is where it hits you.
But do you actually, when you go there, does somebody come to look at you to do what they call the triage to see your level of criticality versus others?
Yes.
Okay.
Yes. You go to the triage, and when you go there, they do all they need to do.
Okay, but then you end up waiting.
You wait forever until